So I want to give a small lecture on ethics. And this is we're going to talk about different ethical principles, and we're going to talk about Tereskov principle. So Tereskov principle is duty to warn. Like, let's say that you see a patient says that he has thoughts about hurting somebody. You want to assess the threat credibility, you want to warn the intended victim, and you want to contact law enforcement when needed. And you also want to document all these things. And I also want to differentiate between capacity and competency. If you're doing consultation psychiatry in that like state, you will be asked to see if patient has decisional capacity. Decisional capacity is where, as a provider, you are evaluating the patient and you're seeing if the patient has the clinical judgment, which is specific to the situation, to make treatment decisions. So sometimes you, for example, you'll see a patient with dialysis who's confused because he has not had dialysis for 2, 3 times and electrolytes are out of whack and he's now delirious and he can't comprehend, and you're asked to see this patient. So you play a role in decisional capacity. You can't play a role in competency because that's a judge's decision. And it's mainly used in financial decisions or also in some other clinical decisions. So then we'll go back to core ethical principles. In this core ethical principles, I want you to understand that there is emphasis on justice is there is emphasis on fairness and equitable distribution of resources. So, for example, when implementing triage systems during emergencies, patients with more critical needs are treated first. So, consider resource allocation in areas like organ transplantation, where a fair process ensures that every patient is considered based on their clinical need rather than socio-economic status. So, that's justice. So, in case of organ transplantation or in emergency room, you want to treat the most clinical need. Now, let's talk about non-malfeasance. This means like do not harm. So, risky procedures aligns with the principle that you're doing no harm. So, you are doing all the safety protocol, things like that. So, do not harm. Beneficence means actions that promote well-being of the individuals. Educating patients on preventive care empowers them to make healthier lifestyle choices. So, initiating a flu vaccine campaign in a community setting is a proactive measure for improving public health outcomes. Now, fidelity is involves honoring commitments and treatment plans. So that means that you're building trust, you're following up on treatment plans, and like example would be maintaining consistent communication with the patient with chronic condition reinforces trust in patient-provider relationship. Now let's look at veracity. Veracity is truth telling and transparency are critical in healthcare. Like let's say that you made an error, you want to discuss that error and disclose that error. That is veracity. Now, autonomy would be you're respecting the patient's right, like somebody who doesn't want to be resuscitated. You're helping them understand what it means, but you're honoring their decisions if they have decisional capacity. Now, you want to document also well. A good example of documentation would be patient expresses suicidal ideation with a plan, crisis team notified, safety plan. So a poor example will patient upset will follow up later. So documentation is very important and we make sure that we are doing a good job with that. Thank you.